welcome back to my channel. So right now we are going to study about the dosage of the UVR, and it's come under the subject of electrotherapy. So right now we are the first dosage what it will be the skin response of UVR depends on. So we come on the first one, the quality of UVR energy applied to the unit area of the skin, or you can say in other words, the quality of the UVR energy applied to the target area of the skin, it whether be the backward, lumbar region, back, and like that, where the patient having pain. Then in this, the other factors inside of it, the sub factors that comes in. The first factor, the output of the lamp. In that it come make time age. If we take the example of age, so in that, for example, you can take an example of young person, old person. If we apply UVR on a young person, he will be have better result, but have the same advantage, but he will tolerate it. But if we apply the UVR on an old person, then because of the old age, the body won't respond same as a young person. So it's a highly affect or damage the health of an old person. That is also a factor. So when we come on the distance, we are go on the sub factor of the quality of UV energy applied to the sub unit area of the skin. So distance between the lamp of the skin inverse square law. So the simple thing is that the distance between the lamp and the patient, it should be a specific distance. If it knows, then you won't get the satisfied treatment or the result or output you wanted. Then we go on the angle at which radiation falls on the skin, cosec law. So the thing is simple that if the lamp and the patient skin or the target area, it should be at a certificate angle for the better outcome. And after we go on the fourth D, fair sub factor, time for which radiation are applied. So as you know, it should be a specific distance, it should be a specific angle, then it also should be have a specific time, because UVR give you the treatment and outcome or the result of the pain of you are want to be treated, but it have also so many damage disadvantage in for example, in the Europe side country, it is was banned. UVR is banned. Why it is banned? Because of so many damn disadvantages. One of the damn disadvantages is that if you see UVR when it's shown, then it can affect your eyes. You can lose your eyesight. So like that. But here the main things you should know: the distance, angle, time. They should be specific. So now we go on the calculation of the dosage subtopic. So in that there are E1, E2, E3 things. So in that E1, MED. So what is that? This is the basic of the UVR calculation, which is determined for individual patient for the skin performance test. It is used like how is the patient's skin performance when we apply the UVR. So from what we know that E1 or MED is a basic in which we just take the test of the how the patient's skin performing or how the performance it will happen. For that, by with that test we can know if we can apply UVR or not. From that point we have other doses of UVR. In that is E2, E3, E4. So for the E2 calculation of doses, what we are going to use there is formula. These are the basic formulas you can use for the calculation of the UVR, doses of UVR. So if we want to know about the E2, so after you get the E1 result, multiply it to 2 by 1 by this 2 1 upon 2 something, yeah, 2 1 upon 2. So indirectly the E1 is equal to E2. In the other E3, you have to multiply 5 by E1. In E4, multiply E1 by 10. You get the doses of UVR result. And the easiest calculation you can say. So guys, for example, if you want to know the the dose at different distance from the lamp to the skin can be calculated by this formula. In that, we take the new dose in which the old dose multiplied to the new distance upon to old distance square. This is the basic formula to find the new dose, guys.